Okay, so take your time to read the stamp and then we will start.
Alright.
Okay, so shall we start?
Yes.
Okay, so how will you assess this patient?
Okay, I will assess this patient according to the advanced trauma life support
Okay,
protocol.
okay, so what are the principles of ATLS?
Okay, the principles of ATLS involve airway management, assessment and management, and cervical spine stabilization, then breathing assessment and management, then circulation assessment and management, then disability assessment and management.
Okay, so can you define and classify shock?
Okay, shock is defined as a state of cellular tissue hypoxia resulting from inadequate oxygen, resulting in inadequate oxygen supply or inadequate oxygen utilization by the cells.
Okay, so give me like broad classification, just name.
Okay, broad classification, the shock can be classified as either cardiogenic shock, obstructive shock, distributive shock, or hypovolemic shock. The distributive shock have subcomponents of spinal shock, neurogenic shock, anaphylactic shock, and endocrine shock, and
Okay,
idiopathic shock.
okay, so differentiate between spinal shock and neurogenic shock.
Okay, spinal shock usually result from peripheral nervous system loss of peripheral nervous system effects, while the neurogenic shock is usually loss of autonomic nervous system effects. In the spinal shock, in both of them there is a bradycardia, while in spinal shock usually uh, the vulvocavernous reflex is variable. It can be I mean it's usually absent. While in neurogenic shock is in neurogenic shock is variable. It can be present or it can be uh, absent. And then the neurogenic shock usually is within hours. It's within minutes to hours, while the spinal shock take longer periods of days to weeks.
Okay, so what are the agents which are used in the management of neurogenic shock?
Okay, the agents used include phenylephrine, dopamine, and no adrenaline.
Okay, so you have been provided with this CT scan. So can you identify the pathology?
Okay, here this showed fracture of C3, body of C3 vertebrae with uh, displacements posteriorly and possible spinal cord compression.
Okay. So can you describe what are spinal cord syndromes?
Spinal cord syndromes include uh, uh, anterior cord syndrome, central cord syndrome, and brown sequard syndrome.
Okay.
Can I expatiate more?
Just give me one or two descriptive points for all these different syndromes.
Alright. The central cord syndrome usually present with progressive bone weakening of the upper limb, much more than the lower limbs. Usually, a pathology resulting from the center of the spinal cord. Usually, it has a better prognosis. It might resolve over time. While the anterior spinal syndrome usually results with in uh, paraplegia, complete paraplegia, and loss of pain on the temperature sensation, while the brown sequard syndrome usually present with uh, ipsilateral loss of motor and spatial senses, pressure, section will be lost if centrally, and the contralateral loss of pain and temperature.
Okay. So, what will be the cause of respiratory depression if the same patient is having C5 vertebra fracture?
Because of respiratory depression could be from the chest trauma, because of the pneumothorax that the patient have, that could be the cause of respiratory depression. It could be associated lung condition. It could also be a reason for respiratory depression, and it will also be from the phrenic nerve injury. I mean, it's because this could also be from the sternal cord injury resulting from the region of the phrenic nerve.
Okay. So, what will be the physiological effects of shallow breathing?
Okay, the physiological effect of shallow breathing, when there is a shallow uh, breathing, there could be there is usually less air entry to the bases of the lungs, fully to the alveolar, and subsequently there could be alveolar collapse in the lower aspect of the lungs, and then that will subsequently lead to atelectasis and fluid accumulation and increased chances of bacterial proliferation with subsequent pneumonia, development of pneumonia. Another way, another physiological causes is there could be increase in additional retention of carbon dioxide with subsequent uh, increase in subsequent disturbance of acid-base balance, respiratory acidosis, and the retention of carbon dioxide can also lead to increase in cerebral blood flow, a subsequent increase in intracranial bedroom.